Your throat feels thick with mucus. You cough, clear your throat, drink water. Nothing works. You've spent money on cough syrups, lozenges, and decongestants that leave you drowsy. The congestion keeps coming back. There's a common fruit that contains a natural enzyme proven to break down mucus at the molecular level. Medical researchers have studied this enzyme in over 40 clinical trials. Doctors specializing in respiratory health have used it successfully for decades. This fruit sits in grocery stores right now. Most people throw away the most powerful part. I'm going to show you exactly what this fruit is, how the science works inside your respiratory system, and the 3 critical mistakes that make this remedy completely useless. If you deal with chronic sinus pressure, morning congestion, or that annoying post-nasal drip that won't quit, stay with me. The fruit is fresh pineapple, but here's what matters. Pineapple contains an enzyme called bromelain. This isn't folklore. Bromelain is a proteolytic enzyme studied extensively by research institutions worldwide. Think of mucus like thick glue coating your airways. When you're congested, your body produces extra mucus to trap irritants and bacteria. That mucus becomes too thick to clear naturally. Bromelain works like molecular scissors. It cuts through the protein chains that make mucus sticky and thick. Research published in BMC Complementary Medicine shows bromelain acts as a mucolytic agent. It reduces mucus production, improves drainage, and decreases swelling in nasal passages. Scientists at the University of Siena in Italy conducted a 30-day study giving patients 500 milligrams of bromelain twice daily. They found that bromelain penetrated from the bloodstream directly into the sinus tissues. Here's the simple version. Bromelain transforms thick mucus into thin liquid your body can expel naturally. This isn't about suppressing symptoms. This works with your natural clearing mechanisms.
This approach works especially well for specific people. If you wake up every morning with a stuffed nose and thick throat mucus, your body's natural drainage system has slowed down. This happens more frequently after age 50. The tiny hair-like structures in your respiratory tract, called cilia, move slower as you age. People with seasonal allergies produce excess mucus during allergy season. Your sinuses become breeding grounds for pressure and pain. Bromelain helps thin that mucus, so your sinuses drain properly. If you've quit smoking but still cough up phlegm, or if you work around dust and chemicals, your lungs are trying to clear irritants. Bromelain supports this natural cleaning process. Anyone who can't tolerate decongestant medications because they raise blood pressure or cause drowsiness can benefit from this food-based alternative. The research shows minimal side effects for most people.
Most people use pineapple completely wrong. These 3 mistakes make the remedy worthless. Mistake number 1. Eating canned pineapple or drinking pasteurized pineapple juice. Research published in Food Chemistry confirms that bromelain denatures at temperatures above 70 degrees Celsius. That's 158 degrees Fahrenheit. Canning requires high heat. Pasteurization uses high heat. Cooking destroys the enzyme. Studies show that after heating pineapple to 70 degrees Celsius, full-length bromelain degrades completely. You need fresh, raw pineapple, not cooked, not canned, not from concentrate. Mistake number 2, throwing away the core. The core contains the highest concentration of bromelain in the entire fruit. Most people cut it out because it's fibrous. You're discarding the most powerful part. Mistake number 3, taking bromelain if you're on blood-thinning medications. This is serious. Bromelain has documented anticoagulant properties. Studies published in thrombosis research journals show bromelain can prolong bleeding time and reduce platelet aggregation. If you take warfarin, aspirin, clopidogrel, or any anticoagulant, bromelain increases bleeding risk. Always talk to your doctor first if you take any medications. Here's the method that respiratory therapists recommend. You need the fresh pineapple core. Method 1. Blend the core. Cut the fibrous center from a fresh pineapple. Take 1 cup of core chunks and blend with 1 cup of water.
You can add fresh ginger for extra anti-inflammatory benefits. Drink this on an empty stomach in the morning. The timing matters. Research shows bromelain absorbs best when your stomach is empty. When taken on an empty stomach, bromelain enters your bloodstream and reaches your respiratory system faster. If you eat it after a large meal, the enzyme stays in your stomach, helping digest food instead of entering your bloodstream. Method 2, eat fresh pineapple chunks, including some core. Chew thoroughly. Eat 1 to 2 cups of fresh pineapple 2 to 3 times daily when you're congested. Clinical studies used doses equivalent to 500 to 1,000 milligrams of bromelain. That's approximately 1 to 2 cups of fresh pineapple with core included. You should notice changes within 30 to 60 minutes. Your mucus becomes thinner, breathing gets easier, sinus pressure decreases.
Here's what happens inside your body. Within the first 15 minutes after eating fresh pineapple, bromelain breaks down in your digestive system. Your body absorbs it into your bloodstream. Between 15 to 30 minutes, bromelain reaches your nasal passages and throat. You might feel the urge to cough or clear your throat. This is your body expelling the broken down mucus. This is exactly what should happen. At 30 to 60 minutes, you reach peak effect. Mucus is noticeably thinner, breathing feels easier, the pressure in your face starts to lift. Effects continue for 2 to 4 hours. Your body's natural drainage system works more efficiently during this window. A study published in the journal Acta Otorhinolaryngologica Italica tracked patients with chronic sinus infections. They received bromelain for 30 days. Researchers found that bromelain distributed excellently from blood to sinus tissues and showed strong anti-inflammatory potential. Research reveals unexpected benefits beyond mucus relief. Studies published in Cellular and Molecular Life Sciences show bromelain reduces inflammatory markers called cytokines throughout your entire body. This means less joint pain, less swelling, faster recovery from minor injuries. Patients with arthritis who took bromelain reported pain reduction comparable to over-the-counter anti-inflammatory drugs, but without stomach side effects. Bromelain also aids digestion. Because it breaks down proteins, eating pineapple after protein-heavy meals helps your stomach digest meat more efficiently, less bloating, and less discomfort. A clinical trial published in Nutrients examined patients after dental surgery. Those who received pineapple extract with bromelain experienced significantly less pain and swelling compared to the placebo group. They also needed fewer pain medications. The safety profile is strong. Studies using doses up to 1,500 milligrams daily for extended periods showed no serious adverse effects.
For active congestion, eat 1 to 2 cups of fresh pineapple, including core, 3 times daily. Best times are morning on an empty stomach, mid-afternoon, and evening before bed. Continue for 5 to 7 days or until symptoms improve. For prevention during allergy season or winter months, eat 1 cup of fresh pineapple daily, including some core. Make it part of your morning routine. Professional tip: some respiratory therapists suggest making pineapple ice cubes. Blend fresh pineapple core with water, freeze in ice cube trays, then add to water throughout the day. The cold soothes throat irritation while delivering bromelain. Store fresh pineapple in your refrigerator. Cut what you need daily to preserve enzyme activity. Bromelain remains stable at refrigerator temperatures, but loses activity when frozen and thawed repeatedly. Your body produces mucus to protect you. When systems work properly, mucus traps irritants and drains naturally. Sometimes those systems need support. Bromelain doesn't force anything unnatural. It doesn't suppress symptoms or mask problems. It works with your body's design, helping thin mucus so natural drainage systems function as intended. This is what sets evidence-based natural remedies apart from pharmaceutical decongestants. Decongestants dry everything out and often raise blood pressure. Bromelain supports normal function without those trade-offs.
The research is solid. Over 40 clinical studies confirm bromelain's effects on inflammation, mucus, and respiratory health. Fresh pineapple used correctly provides real relief without the side effects of pharmaceutical options for most people. This isn't about replacing medical care. If you have chronic respiratory conditions, work with your healthcare provider. This is about giving your body natural tools that science has validated. If this information gave you a practical option for managing mucus and congestion, take action right now. Type "trying this" in the comments if you're going to buy fresh pineapple this week. Share your experience if you've already tried this approach. Your comment helps other people who are searching for real solutions. Share this video with someone who struggles with chronic sinus pressure or seasonal congestion. A parent, a friend, anyone tired of medications that don't work or cause unwanted side effects. Subscribe because I bring you evidence-based health information every week. No exaggeration, no fake research, just published science you can use to make informed decisions about your health. Your respiratory health matters. Small changes like adding fresh pineapple to your routine can make a real difference when you understand how to use it correctly. Take care of your body. It's working hard for you every single day.